and initially access to doctor's surgery worked fairly well by using their name, their address as my home address, and all my post would go to them. However, they've recently stopped that service, which has given me a bit of an issue. Their suggestion was to use my workplace, which has also given us a bit more of an issue around when we're closed over Christmas and that you have appointments between Christmas and New Year. You're not actually, I can't pick the post up, so I wouldn't have got the letters. And it's just caused, it worked, it was a service that worked really, really well, and now that they've changed it, it is giving me a few issues because I don't want my post to come to my home, to my work address. Generally it's around getting a point, because we move around so much, it's finding a surgery that will actually let us have an emergency appointment. And the hoops you have to go through sometimes to get that emergency appointment. They want forms filled out and can't necessarily see you when you want to be, when you're about to be seen. So if they give you an appointment in like a week or 2 weeks' time, well, you've moved on by then, because you can't stay moored for that amount of time in some areas, especially if you're trying to moor in town. If you're rural and are prepared to walk back in, or able to walk back in, that's okay, but if you're not, then that's where we get big problems. And also there's things around being taken ill while you're on a boat and you're maybe in a remote area. We had an incident last year where a gentleman was taken ill on a boat near us, and then it was around getting the emergency services to him in his boat, and it was very remote. We ended up actually moving his boat into town while my partner drove the boat into town so that the ambulance service could actually get him out of his boat. So it does give us a few issues, especially if we are taken ill out of a town. More accessibility for areas where people moor, so that emergency services can get there, and also around appointments. Surgery's been a little bit more flexible and able to cope with people who are technically classed as homeless. Going back to the reason that they stopped us using the address was they were saying that it was more difficult to get hold of homeless people, they weren't attending appointments, whereas I can say for myself, I attended every appointment and picked up my post promptly. Okay, it might not be the case for everyone, but you know, to the best of my ability, I did what we could do. And why should we be penalised for the few that don't? We get classed as being homeless, which is it's not really the case. We actually have a home, but it just happens to be on water. And I think some of maybe the way round sorting this issue out might be more education for the surgeries, for them to understand that we're not homeless, we just move. That's basically what we do. So I think there is definitely a need for more education for surgeries so that they can understand our living lifestyle, basically. Living on a boat's great. It's a very slow pace or a slower pace of life, which is why I chose to do it. I needed to slow down, basically. It does mean you're more aware of your surroundings. You're more aware of what you use. You're living off grid, so you've obviously got to support yourself. So things like you're more aware of how much water you're using. You're more aware of the fact that you need to charge your batteries to get your electricity. And for me, I really enjoy that. And you meet people, and then generally other boaters, very friendly. You will muck in and help one another, hence the helping the guy who was taken ill on his boat. And it's just a slower pace of life. That's the bit I really enjoy. And being in nature as well, more healthy.